Well, hello there, fellow NARFE Floridians. My name is Tammy Flanagan, and I'm a member of NARFE Sarasota Chapter 242. I'm really honored to be asked to be at this conference today to present to you information about the new Postal Service Health Benefit Plan. So before we get started, for those of you who haven't met me before, here's a little bit of information about what I do and my background. I've been working in the area of federal retirement benefits and insurance since 1985, so I'm really dating myself. I've been working with NARFE at the Federal Benefits Institute since 2015 when we started doing webinar presentations for NARFE members. Maybe some of you have attended some. If you haven't, we have those archived at the NARFE Federal Benefits Institute, as you can see it there on the home page on this slide. The other things I do is teach pre-retirement seminar presentations for the National Institute of Transition Planning, and I co-host a podcast with Micah Shalansky out of Alaska called Plan Your Federal Retirement. So that's all through my company called Retire Federal. So at an age when I probably should be retired, I feel like I'm busier than ever. But it's something I love doing and have a passion for helping people understand their retirement and insurance benefits. So today, in the time that we have together, we're going to be talking about, as I said, the Postal Service Health Benefit Plan, which is brand new. It's a subset of the Federal Employees Health Benefit Plan, and it's going to cover all postal employees and retirees from January 1st of 2025 on forward. So I'll give you an update of where we are with that plan and how that plan coordinates with Medicare, and also some ideas of things to do during this open season or things to think about during this open season as you're making decisions about which Postal Service Health Benefit Plan you want to be enrolled. And I'll provide you with some resources so you can learn more as well. So the update here on the Postal Service Health Benefit Plan, or PSHB, is that it's a new program as a subset of the Federal Health Benefit Program. It is administered by OPM, just like the FEHB program always has been. It's specifically for eligible Postal Service employees, annuitants, and your family members as well. This represents 20% of the current FEHB population, so there's a big subset of enrollees who are leaving FEHB and moving into that PSHB program that's going to start next year. The open season begins on Monday, November 11th, and it's going to run through December 9th, which is also a Monday. So you have that month period of time to make a choice if you want to change your plan and choose a different plan than what you're going to be automatically enrolled in starting on January 1st. So if you don't do anything, you'll receive a letter, maybe you've already received it, letting you know which Postal Service Health Benefit Plan you'll become a member of next year. It's most likely the same plan you're in under FEHB, but it will have a new plan code as part of the PSHB program. So we're going to talk about how Medicare and the PSHB program coordinates. Now, of course, we're more familiar with FEHB because that's what we've had up until this year or through this year. So Medicare has been something federal employees have paid taxes for through that payroll tax, that Medicare 1.45% payroll tax, since 1983. But up until next year, it's always been an option whether or not we actually enrolled in Medicare Part B. That payroll tax is financing Part A of Medicare, so we don't pay a premium for the hospital insurance portion of Medicare. But there is a premium for Medicare Part B, and that's where we have a lot of confusion about which federal plans we should use to supplement Medicare Part B. Postal retirees are going to be required to enroll in Medicare Parts B and the Prescription Drug Benefit Part D, which will be part of your Postal Service Health Benefit Plan, starting next year. There are some exceptions, and many of you listening may be exempt from the requirement to be enrolled in Part B, B as in boy, the outpatient part of Medicare. There was a special enrollment period earlier this year that ran from April through September for those of you who were retired and over 65 but didn't enroll in Medicare Part B when you turned 65. So some of you for the first time will become enrolled in Medicare Part B starting on January 1st, and that will become your primary insurance if you're retired and enrolled in Medicare A and B. Your Postal Service health benefit plan will act as secondary payer, kind of like a Medicare supplement would be for someone in the private sector. So there are going to be many postal retirees who will have to enroll in Medicare to maintain their coverage under the Postal Service health benefit plan. This is different than what we've known under FEHB, where it's always been an option. Even though it's optional, the majority of FEHB members do enroll in Medicare A and B once they're retired and over 65. But I know some of you listening maybe had decided not to do that. You thought, why pay the extra money for Part B when I'm allowed to keep and maintain my federal health benefits beyond age 65 into retirement? So for those of you who didn't enroll in Part B, you're not going to be required to do that now if you're already retired and haven't opted into Part B, even during that special enrollment period. So here's a little recap. For those of you who are retired right now, and on January 1st, 2025, you're not enrolled in Part B, you're not going to have to do that unless you want to. You can still enroll, but you're not required. Now, if you're retired and you're already enrolled and covered under Part B on January 1st, then you'll be required to maintain that coverage in order to stay under the PSHB program. Now, for those of you who are still working and employed in the Postal Service, if you're under age 64 on January 1st, you're going to be required to pick up Part B once you're retired and over 65. Now, while you're working, even if you work beyond age 65, you can delay Part B enrollment until you retire. You'll have a special enrollment period to pick it up. But once you're 65, you must enroll during that special enrollment period or during your initial enrollment period if you're turning 65 after retirement. Otherwise, you'll lose your PSHB coverage. Now, if you're 64 or older on January 1st, and you're still employed, you're not going to be required to pick up Part B even when you retire. It'll still be an option for you. So here's some other exceptions of folks who don't have to enroll in Medicare Part B starting next year. Postal Service annuitants or family members who live outside of the United States and its territories. Well, Medicare doesn't work overseas, so therefore there's no requirement to be in Part A or Part B in order to maintain your Postal Service health benefit plan. If you're eligible for benefits through the VA, then you don't have to pick up Medicare Part B in order to maintain your Postal Service plan if you go outside of the VA facilities for health care. Postal Service annuitants and family members who are eligible for the Indian Health Services, you will not be required to pick up Part B as well. You can just maintain your PSHB program without the requirement to pick up Part B. Okay, some more updates here. So this has to do with your family members, your spouse in particular. So based on your enrollment, entitlement, or eligibility, your family members are going to basically have to follow suit. So if you're required to enroll in Part B, then your spouse will be required to enroll in Part B as well once they're eligible. If you're not required to enroll in Part B, if you meet one of those exceptions, your spouse will also fall under the same exception. And retirees who are already enrolled in Part B, your covered spouse will be required to enroll as well when they're eligible, unless they qualify for one of those exceptions. Now, when it comes to Medicare, there's really two ways to have Medicare coverage. One is through Original Medicare, and that's what most of our federal retirees are in. That's Medicare Part A, Medicare Part B, and then your federal health benefits, or next year, Postal Service health benefit plan will act as your secondary payer. The other way to have Medicare coverage is combining Medicare A, B, and D into a Medicare Part C or Medicare Advantage plan. So when you enroll in a Medicare Advantage plan, you do have to be enrolled in Medicare A and B. If you do this through your Postal Service health benefit plan, because most of them will offer a Medicare Advantage option, Medicare Part D, the prescription drug benefit, will be incorporated into that. And when you're using that health plan, you'll show your health benefit card when you go for services. Even though you have Part B, you won't have to carry your red, white, and blue Medicare card. All of your services will be wrapped up in that Medicare Advantage plan, and that's who will be paying for those services. And Medicare is part of that, but you don't have Medicare separate. So here's an example of Part A. This is the easy part. This is the part we've already paid for during your career by paying that 1.45% hospital insurance tax or Medicare payroll tax. So if the doctor says we're admitting you for hospitalization, you're going to spend the night, you're being admitted, then that hospital bill is going to go to Medicare first, Part A, and Medicare will pay everything but the first $1,632. Now that's in 2024. That's the deductible for Part A. Majority of your federal health plans will pay the full amount of that $1,632, because many of your plans, once Medicare is primary payer, they're going to waive your cost sharing, your deductible, your copay, and your co-insurance for anything that Medicare is the primary payer. Now, once you go beyond 60 days in the hospital, and you might wonder who goes beyond 60 days. Most people don't stay more than 2 days, but you probably know people, as I do. In fact, my brother-in-law has been in the hospital since the end of March. He had a stroke this year, and he's still getting services in the hospital. He's moving in and out of rehab to try to get back on his feet and to recover as much as possible from his stroke. So there are times in our life when we suffer from chronic illnesses that just take a long time to really recover from, such as a stroke or a bad fall or other chronic illnesses. So during that time, Medicare stops paying like they did for the first 60 days. There's going to be a $408 per day co-payment for every day from that 61st to 90th day. Thankfully, your federal health plans will pick that up. So you'll still have your coverage under PSHB, just like you do now with your FEHB plan. So when your inpatient hospital bill comes, it should say you owe zero once Medicare and your federal plan has paid. Also, at the bottom of the slide, you can see where it says check Section 9 or your plan website to learn about whether or not that plan option that you're enrolled in waives the cost sharing when Medicare is primary. Here's the premiums for this year for Medicare Part B. $174.70 a month per spouse is the standard rate. That's what everybody pays who has Medicare Part B, unless you qualify for extra help through Medicare and through your state. If you have low income, you might qualify to have that Part B premium reduced or even waived. So talk to the state health insurance counseling program, or in Florida we call it the Florida Shine program. And that's a place where you can learn about the requirements to be entitled or eligible for extra help. But most of us pay the $174.70 a month. Now, if you're in a higher income bracket, if your modified adjusted gross income from 2 years ago was higher than $103,000 if you file as a single taxpayer, or higher than $206,000 if you file a joint tax return, you're going to pay more than the standard rate. We call this IRMA, the Income-Related Monthly Adjustment Amount. Now, if there's 2 of you, just double that. As you can see what I did here, I took that standard rate, multiplied it by 12 months. You can see that even at the standard rate, it's costing a little over $2,000 a year to enroll in Part B. Times 2 spouses, that's over $4,100, almost $4,200 a year. Now, once you start going into those IRMA brackets, it goes up exponentially. So that's where it becomes a really difficult decision to enroll in Part B if you have the choice. Like I said, some of you are going to be required to do it in order to maintain your Postal Service health plan. Now, if you say, well, my income 2 years ago was much higher than it is now, maybe because I went through a divorce, maybe because I retired, maybe because I sold that rental property and I no longer have that rental income coming in. So if you had any one of these life-changing events that have occurred since Social Security determined how much you have to pay for Medicare, you can appeal that higher rate by showing them how much your income is now compared to what it was 2 years ago. You'll need this form, Standard Form 44, or you can go to Social Security and set up an appointment to appeal that IRMA surcharge. Now, what we call wraparound coverage means that your federal health plan or your Postal Service health plan is going to waive your deductible, co-payments, and co-insurance when Medicare becomes the primary payer. It wraps around Medicare, giving you 100% coverage on all of your medically necessary care. Now, what's nice about Medicare as we go beyond age 65 is that Medicare was designed for people over 65. It has very good benefits. It works well with doctors, and it provides coverage while you're recovering from an illness, a fall, or any other type of chronic condition. Now, standard rate of Medicare Part B, that $174.70 a month this year, which is likely to go up to $185 a month next year, plus your Postal Service health benefit plan that offers incentives to enroll in Medicare, can actually cost you less than some of the FEHB plans by themselves. I'll show you that in a couple of examples that I have. So once you've paid for the Part B premium and you've continued your Postal Service health benefit plan, you should have very little out-of-pocket expenses. You'll still probably need a dental plan or a vision plan under FedVIP, and you want to make sure you have good prescription drug coverage because those are things that aren't covered by Medicare A or B. So insurance against the cost of expensive treatment and care is one of the benefits of having Medicare Part B. If you've ever looked at your health plan's catastrophic cap, even for in-network coverage, that cap could be $6,000, in some cases even $8,000 or $10,000 a year. When you have two people, either self plus one or even a self and family plan, just double that. So the catastrophic cap can be $5,000, $15,000. I've seen one as high as $24,000 for family or self plus one coverage. So you avoid that catastrophic year by having that combination of Medicare with FEHB. Because if you have 100% coverage, you're not going to have those out-of-pocket expenses that's going to lead you towards that catastrophic out-of-pocket expense. And remember that we might only be 65 today, but there can come 75, 85, 95, and some of us are going to live all the way to 105. So we want to make sure we're thinking long term. Because you might be saying, well, I'm really good health now. I only go to the doctors once a year. I don't need Part B. Well, maybe later on you're going to change your mind. And if you enroll in Medicare late, there's a late enrollment penalty of 10% for every 12 months you've delayed enrollment. So if you wait 10 years from 65 to 75 and decide to enroll in Part B, you're going to pay double just because you've waited 10 years at 10% a year. And that's a permanent penalty. So the time to think about this is either when you turn 65, if you're already retired, or when you retire if you work beyond age 65. So how much do you save? Well, you might save the premium for Part B by having these incentives. So Medicare covers expenses sometimes that your postal plan might not cover as generously. So you might look at things like physical therapy. Your plan might pay for 30 visits a year, where if you're showing improvement, Medicare will approve additional time in physical therapy or occupational therapy if you're showing improvement beyond what your plan limits are. Medicare, when combined with some of your postal plans, will provide, like I said before, close to 100% coverage. Your out-of-pocket may be limited to only your prescription copays, dental and vision out-of-pocket expenses. Like I said, don't forget about FedVIP that you enroll in through the benefits program to get your dental and vision coverage. So you're going to look for a plan that waives your deductible, waives your copayments, and waives your co-insurance once you're in Medicare, because that way you'll have that 100% wraparound benefit. So here's some information about Medicare Advantage. So I said there's two routes into Medicare, using Original Medicare and a regular fee-for-service or HMO plan, or going the Medicare Advantage route that's all wrapped up in one, A, B, C, and D. Now, most of you who are going to use Medicare Advantage plans are going to do so through your PSHB program. Like I said, most of them are going to offer a Medicare Advantage option within that program. And that's going to be your better bet in most cases than going to Medicare.gov and picking one of the plans that are in your zip code. Those are the plans you've seen on TV. Maybe in your mailbox you've gotten advertisements for the Medicare Advantage open season that's been going on since October 15th, I think it started. So the ones through your PSHB plan are going to give you that wraparound coverage, leaving you with very little out-of-pocket expense, if anything. The commercial plans, some of those are free of premiums. You still have to have Part B and pay for Part B, but the actual plan itself, the Advantage plan, sometimes has no premium, but there are out-of-pocket expenses. You're going to pay every time you visit a provider. You're going to have to meet a deductible. So don't be deceived by the fact that those premiums are free. You're still going to pay out of pocket for different care, and you might have more restrictions on which providers you can see. Now, these Medicare Advantage plans, they may not be so popular amongst federal employees, at least not until recently, but in the United States as a whole, they've become most of what people do when they turn 65. It's more than 50% in many states. You can see all those green states, including Florida, is 50 to 60% of Medicare eligible individuals are enrolled in a Medicare Advantage plan. So we do have those in Florida and across the United States. Some states you can see have a very light enrollment. These are those upper Northwest states where the population's a little lower, and the doctors can choose not to take the Advantage plans because there's very few doctors in town. So those places you won't see Medicare Advantage as popular. So, excuse me, Part D of Medicare, or the prescription drug program that we have through most of our federal health plans, and next year through all of the postal plans, you'll have a Part D coverage under your postal plan if you're eligible for Medicare and you're retired. So if you opt out of that Part D plan next year as a postal retiree, you're going to lose your prescription drug coverage even through the underlying PSHB plan, and your premiums will still stay the same. So be careful about that. I know this year a lot of folks did opt out of Part D. They might have been in the IRMA categories and had to pay extra for Part D. Maybe they don't have a lot of prescription drug expenses, so they just opted out. If you do that next year, you stand to lose your prescription drug coverage altogether, so be real careful. Part D was introduced this year to FEHB because there's been some changes to the Part D Medicare program. It's trying to rein in the cost of prescription drugs, especially those name brand drugs. So they're going to bring down the cost by negotiating. Centers for Medicare and Medicaid Services, for the first time, is going to start negotiating with the drug companies to get those prices down. So that's going to come in slowly but surely by introducing a few drugs that's going to start the ball rolling. Some very common drugs that people use, such as Eliquis and some of those expensive blood thinner drugs. Those will start happening next year and the year after, and you'll see more and more added into that program. So for more information about Medicare Part D, you're going to want to check your Postal Service Health Benefit Plan brochure and or the plan website as well. You can also find a lot of information on Part D at Medicare.gov. Now, one of the drawbacks to Medicare Part D is if you use a manufacturer coupon, like your doctor says, hey, I want you to go on this new drug, but it costs $2,000 a month, so here's a coupon, you'll get it for $10. Well, you can't submit that claim. The pharmacist can't submit the claim through Medicare if you're using a drug coupon. So you're either going to use the drug coupon or it's going to go through Medicare Part D. And some pharmacies will tell you, and I'm honestly not sure if they have to tell you this, that if you're a Medicare Part D participant, that you can't even use the coupons. So that's something I'm still trying to get definitively answered. I've gotten the answer both ways, that yes, you can still use the coupon if you don't use Part D, and other people have said, in fact, people who are part of the federal health benefit program have said, no, If you're under Part D, forget about the drug coupons. So all I can say is try it and see what happens. Here's a couple of comparisons. I know we don't have a lot of time in our segment, so I'm going to make these slides available to you so you can kind of study these a little bit more later on. I'm comparing Blue Cross Basic to Blue Cross Standard. You can see the second row, and this is what I'm thinking Part B is going to cost next year. It hasn't been set yet in stone, but this has been what read is a proposed rate for Part B, $185 instead of $174.70. So what I did here was I added the 2025 premium for either self-only or self-plus-one coverage to the Medicare Part B premium, and then reduce that by any rebate that plan offers once you're in Part B. So many of the federal plans will give you some money back, or they'll actually reduce your Part B premium once you're over 65 and enrolled in Medicare A and B. So you can see the bottom line is the total monthly cost for that plan, whether it's self-only or self-in-plan, when combined with Medicare Part B. The reason why I don't recommend Blue Cross Standard option with Medicare B is it's just too expensive. You can see the difference between self-only Blue Cross Basic and self-only Blue Cross Standard when you add Medicare is over $200 a month difference. For family coverage, it's even more. It's almost $3 to almost close to $400 a month difference, not for family, but for self-plus-one. More for family coverage if you have kids on the plan. I compared mail handler standard option to letter carrier's high option. Very comparable plans. These are both the Medicare Advantage options in those plans. I think they're both run through Aetna. Very similar, but what's funny here is the self-only plan combination is less expensive under mail handler standard option, but the self-plus-one option is more reasonable under the NALC plan. And under the NALC plan, you'd actually be signing up for the self and family, which is less expensive than the self-plus-one. That's the premium I'm showing here, that $516.58 is the self-plus-one, or the self and family price. But if you're a family of two, that's what you would use. It's less expensive. There's no reason to enroll in the self-plus-one plan. And here I'm comparing postal workers high option with GEHA high option. Again, very comparable plans. They're both offering Medicare Advantage options through United Healthcare instead of Aetna. So you can stack those up side by side to see what other features those plans offer to see which one might be best for you. And actually, any one of these plans I'm showing will work well with Medicare. I'm trying to pick out plans that are specifically designed to work with Medicare by offering a rebate or a reduction in the Part B premium and waiving all that cost sharing so you don't have the out-of-pocket expenses. These two plans are becoming very popular because of the price. These plans are Aetna plans. They're not HMOs. They're nationwide plans, but these were designed specifically in the Aetna family to work with Medicare. Initially, Aetna Direct became available, I think it was in 2015, and then more recently, Aetna Advantage plan came out. If you're not on Medicare, these plans wouldn't look very attractive to you because without Medicare, they have a high deductible and they cover things that young folks really don't need a lot of, such as hearing aids, a lot of good benefits for skilled nursing care, and things that we might need as we get older. So these plans can be a really good deal because they don't have a lot of younger folks or retirees who don't have Medicare in them, so they can really hold the price down and provide excellent benefits. So these are two to look at as well during open season. So to find out more information during this open season, here's where we're going to find all the information about your health plans. Now I looked today and these have not yet been updated. Now by the time you see this recording, because I'm doing this a little bit early, this should all be updated on your OPM website. So it'll say plan information for 2025 rather than 2024. And I'm not sure if OPM is going to put up a separate page for PSHB or they're just going to combine it all with FEHB. I really hope they make it separate, and I think they will. So you just choose your state and it's going to list all the plans available in that state. It would look like this. Once you click on your state, you'll start seeing all the fee-for-service plans, followed by the restricted plans, and at the bottom, the HMOs and the consumer-driven plans. Now, your plan brochures and planned flyers that are out, this one's out now for Postal Workers Union, gives you a lot of details on what that plan covers, how that plan is going to work with Medicare, what the prescription drug benefit looks like. So these are going to be some really good resources for you. These are all available on the plan website. If you attend a health fair, maybe someone's coming into your chapter meeting from the health plans, they might bring some of the brochures with them. Additional options that I didn't put on my comparisons, and these are all available in Florida. Compass Rose is restricted to intelligence organizations, so if you retired from the CIA or NSA, this is a plan you might want to look at. SAMBA, that's a plan open to everybody. It's a nationwide plan. It's a PPO with a Medicare Advantage option. Foreign Service Benefit Plan, available to State Department, and also anybody who was in this plan as an employee can also have it as a retiree. That would be DOD, people who have worked overseas or in the intelligence community, they're all eligible for this foreign service plan as employees. But postal workers probably don't fit that definition, right? Rural Carrier Benefit Plan is one of the restricted plans that some of you might qualify for. That's also there. AvMed is an HMO in South Florida. Capital Health Plan is an HMO in the Tallahassee area. And United Healthcare is really available pretty much throughout the country and a fairly popular plan in the state of Florida as well. It's a Medicare Advantage plan that you'll get to use under the PSHB program. So if you want to suspend your federal health plan or your Postal Service health plan to use either a Medicare Advantage plan on Medicare.gov, or if you have TRICARE as a military retiree, or if you go to join the Peace Corps and go under their health plan, those are reasons you can suspend your Postal Service plan and use those other coverages. If you've already suspended your health plan under FEHB, it will remain suspended under PSHB. So when you re-enroll, or if you ever re-enroll in the Postal Service plan, that's when you'll choose which plan you want to re-enroll in. So TRICARE for Life is the plan that a lot of our military retirees use and their families. So in these cases, this is really good coverage because there's no premium for TRICARE for Life. You've paid for it with your military service, so there's no additional premium. You do have to have Medicare A and B, but there's no need for Medicare Advantage or Medicare Part D. So a lot of folks with TRICARE for Life will enroll in Parts A and B and then suspend their federal plan once they're retired. The VA facilities, they don't take Medicare there, but a lot of folks who use the VA facilities do have Medicare coverage that allows them to go outside of those providers. Now, if your spouse is 65 and older and you're using the VA facility, they may be eligible for Chant VA. Now, that's going to be available if they have Medicare A and B, if they're over 65. So they will have to have A and B. Now, keep in mind, if you're thinking about canceling your Postal Service plan and not enrolling in Part B because you get all of your care at the VA, be aware that things can change in the future. And if you try to enroll in Medicare Part B down the road, there's going to be a late enrollment penalty. And once you drop out of PSHB, it's a one-way ticket out once you're retired. So be real careful about choosing to cancel your Postal Service plan, because once you're out for good. Some other resources are the Checkbook Guide for Federal Health Plans. This is a wonderful resource that allows you to do a side-by-side comparison of up to 4 different plans, showing the Medicare reimbursement, showing the inpatient care benefits, showing the skilled care, the hearing aids, the dental and vision plans that might be part of that health plan. So the Checkbook Guide provides a 20% discount for NARFE members by putting NARFE 20 in the discount code.